Welcome, friends. This is Dr. Jaitly, your cardiologist, on your favorite video site, MuniMeterHealth, which is being shown on several social platforms, primarily for enhancing medical education and patient education in order to improve the clinical outcomes, as you see here. It's my deepest belief in the past 40 years I've been in practice where I've taught all my patients about their health and illness, and believe it or not, it works much better in terms of adherence, their compliance, their ability to take the prescriptions, ability to successfully counsel them against smoking, alcoholism, and what have you. So patient education cannot be compromised at all, and that's where I'm pushing mainly this video channel for, in addition to, of course, educating my medical fraternity. So welcome again to being on MuniMeter Health. Without any further ado, some housekeeping rules here. Number one, this is not a substitute to your syllabus, my dear medical students. It is a supplement. You could use that and, of course, stick to your syllabi from your universities, etc., etc. Two, it's not a treatment advice channel. It's purely an educational channel. So do not seek any advice here and look for your doctors to really get your advice, because they know you the best. And thirdly, if it's an emergency you're having, obviously, you have to call 911 if you're in the United States. Otherwise, get to the nearest hospital, call for an ambulance, etc. Okay? Now, without any further ado, let's delve into the subject matter here. Today, we are discussing what is BP, and why is it only what is blood pressure? In other words, why is it it's only a number, and why is it so important? Well, a lot of the things are just bare numbers or signs. I'll give you an example. I love these analogies. When you're driving in a car, you see so many signs that normally come on as soon as you start the car, right? Check engine, check oil, fluids, and then they all go off. Thankfully so, right? Including your seatbelt signs, including your how much air pressure is now, how much your oil pressure, what's your brake fluid, and what have you. So all these are on the dashboard of your car. Now, very importantly, blood pressure is also one of those things. Imagine that it's also a sign that flashes. Okay. Now, if certain signs on your car, they begin to flash while you're driving, and after several weeks, it'll say, okay, service is due. Now, if you ignore that for maybe for a couple of days, that's fine. But if you're ignoring for a longer time, you may be in trouble, right? Same thing is true, and depending upon what sign is showing up. Like if it says low pressure in the air, you better pull over and have your thing checked at a service station. Same thing is applying here. Blood pressure is an alarming sign. Normally, the normal blood pressure should be 120/80. Now, 2017 guidelines of ACC and the AHA, by the way, they work together on these. And 2017, the American College of Cardiology and the American Heart Association, they came out with the blood pressure guidelines, and they recommended down to the WHO and to the rest of the world. And they're saying that anything over 120/80, 120 being the systolic and 80 being the diastolic, is considered as abnormal. So in other words, 125/85 is abnormal, and that should be watched. Now, blood pressure, remember, your blood vessels are traveling throughout your human body, throughout your body, rather, from brain to toes, and the blood is being carried through these blood vessels. And what is it bringing? It's obviously bringing a lot of oxygen. It's bringing all these fancy nutrients that you have taken for the day and what have you, right? And it's also removing all the toxic stuff like the CO2 and the ammonia and the nitrogen, etc., and it's all being removed either via the urine or bile. Okay, so it's very, very important that we actually maintain this circulatory system in the human body. And what is driving the circulation is obviously the heart. So here you have the heart, folks. Unmistakably, these are your lungs. That's your left lung, and this being your right lung. So because the heart is situated right in the middle of the chest, with the apex pointing more to the left. This being your left, and this being your right side, like you're facing the person. Now, I'm making it very easy for the patient so that we understand that so easily. Now, this is your brain. And these are your eyes, your lovely eyes. This is your liver. These are your kidneys here. Two sets of kidneys. The right kidney is a little slightly lower in order to, fit in your liver here, which is also on the right side. And that's a pretty solid organ, and that's the metabolic factory here. The kidneys are the filtering organs, okay, if you will. So all the toxic stuff is coming out, like the excess of ammonia and, say, acid production that's going on, or other certain unwanted electrolytes or excess electrolytes. They're all being peed via these kidneys. So they are being filtered. Now it's very, very important that you have all these vital organs: the lungs, the brain, obviously the heart, the liver, and your vessels and the kidneys. They all function. I've shown you only the vital organs. I've not shown you the non-vital organs. But these are vital organs. In other words, without which you can't function. You can't function without the brain. You can't function without the liver. You can't function without your kidneys. And therefore, you can't function also without your lungs. And obviously, heart is your engine. So the whole idea is wanting to see if you can actually prevent the damage to these target organs. What they're called? Target organs. Why? Because the blood pressure is being transmitted via these vessels to all these lovely organs, and that's what is the target organs are. So in the brain, if the vessels, these are vessels now, and they're all supplying various organs. So when these vessels traverse through the brain, obviously there is a certain amount of pressure that's permissible. That's 120/80. If it starts rising to 125/85, there's a little alarming sign. But now if it goes to 140/100, which is your diastolic, for instance, or if it goes to 180/120, that's a very, very dangerous pressure, if you will, and that can lead to a stroke. So we call it stroke can happen in these patients. So that's the danger. Sometimes it's transient only. It's called transient ischemic attacks, TIA. In the heart, obviously, what will be the effect? In the heart, you'll have a heart attack can occur. Why? Because of the oxygen not getting sufficiently to the coronaries. These are your coronaries here, my friends. Coronaries are the blood supply to the heart, and heart is supplying to the body, obviously, through this aorta. So there's a lot of information in these short videos, but I'm trying to summarize rather quickly here for you and keep it simple, especially for the patients and the general masses, and of course my lovely medical students. Now here you have the eyes. Eyes will obviously have very fine arteries called retinal arteries, and they can undergo certain changes, so the blurring of the vision can begin if the hypertension is out of control. Sometimes hemorrhages can occur, etc., etc. So we call it retinopathy. Retinopathy. Pathy means abnormality, and retinopathy, that means abnormalities in the retina that can develop here in both the eyes. And obviously I've just talked about heart attack. Angina is obviously reversible, but the fact is that can occur also, and that's also it's a manifestation of a chest pain related to ischemia, or lack of blood supply to the heart. In the liver, of course, the metabolic factory, liver can suffer and can get swollen and can get enlarged. It can become, obviously changes can develop because of the blood pressure here. But more importantly, in the kidneys. Now, let's understand, in the kidneys, obviously, patients can develop called CKD, and that's called chronic kidney disease. Their creatinine can start rising, BUN may start rising, and these are the parameters that we normally test in the blood, and that'll give us a clue that the chronic kidney disease is starting to ensue now. Vessels can get hardened, and remember, these are the atherosclerotic plaques, and these plaques, they can get I'm writing in the corner here, plaques, almost the end of the page here. The plaques, PLAQUES, these plaques can actually get more and more thicker, more depository here right within the vessels. Remember, these vessels are running all over your human body. So these vessels internally, they can have more hardening surfaces like plaques developing, and as a result the artery can get narrow, and now the pressure will start rising. So the blood pressure will again rise as a result of this. So remember, these vessels are so important. We want to keep them as functional as possible, keep the flow as fluent as possible, so this way we can not compromise on the circulation. So my good friends, just remember, stroke in the brain, retinopathy in the eyes, heart attack and angina in the heart, obviously, and chronic kidney disease, we call it, in the kidneys can develop, and plaques will develop in these vessels. So these are very, very important target organ damages, we call them, and these target organ damages can affect all these lovely organs that I've drawn here for you. And remember, blood pressure is the culprit. Now, how do you we'll talk about how do you control blood pressure and how do you maintain it in a different video, or perhaps I've already done it if you have reviewed it, but just be mindful that this video was only primarily to tell you why blood pressure is important and why is it important to control, even though it's only a number and you may be feeling fine. Even normal people, when they feel fine, they should have their blood pressures checked and control it. Okay, well, looking forward to seeing you again, and stay well, stay healthy, and stay with MuniMeterHealth. Looking forward to seeing